Hello, and welcome to this special webinar hosted by the American Cleaning Institute titled Clean Hands and Spaces. I'm Brian Sansoni, ACI Senior Vice President of Communications, Outreach, and Membership. Today's webinar is part of a joint initiative between ACI and the Centers for Disease Control and Prevention, which is known as Healthy Schools, Healthy People. This initiative is designed to support school systems nationwide with tools to help reinforce hand hygiene and cleaning practices to prevent the spread of infectious disease and reduce related absenteeism. The Healthy Schools website offers resources for teachers, educators, school nurses, administrators, parents, and students. The site features interactive games, quarterly newsletters, educational webinars like this one, and targeted social media messaging. For more information, please visit healthyschoolshealthypeople.org. We thank you for taking the time to join us today. This webinar will provide an overview of CDC's new online training for educators, administrators, and supporting personnel in schools and early care and education settings. The Clean Hands and Spaces training, which is available in English and Spanish, will equip educational communities with the knowledge and skills to encourage good hygiene practices. Before I introduce our expert speaker today, I want to mention that this webinar is being recorded and it will be available on demand, and all registrants will be notified in the days ahead. We are fortunate to have with us today Ashley Andujar, Health Promotion and Communications Team Lead at CDC's Waterborne Disease Prevention Branch. In her position, she leads behavioral science and strategic communications activities to promote disease prevention and control of domestic and global water, sanitation, and hygiene-related diseases. Since joining CDC in 2015, Ashley has supported multiple public health emergency responses, including COVID-19, the 2017 Hurricane Maria response, and Zika. She received a master's degree in Health Services Administration and a bachelor's degree in marketing from the University of Puerto Rico. Ashley, we welcome you to today's webinar, and we look forward to hearing your expert insights on the Clean Hands and Spaces training. Ashley, take it away.
Right. Thank you, Brian, for the introduction, and thank you, ACI, for having me. Today, I will be giving you an overview of our new CDC training called Clean Hands and Spaces, which I'm very excited to share with you. During the presentation, I'll be providing you some background on the goals of this new training and why we developed it. We'll go over the content and themes that are included throughout the training. We'll also talk about our dissemination plans around it, and I'll be sharing a few resources and communication materials that can be used to encourage hygiene in educational settings. So promoting hand hygiene practices and cleaning and disinfection are important everyday actions that staff in educational settings can take to prevent the spread of infectious diseases and to protect their community. Staff in these settings, such as school administrators, principals, teachers, or custodians, play a critical role in helping to break the chain of transmission of infectious diseases and to keep everyone healthy. So for example, we know that hygiene promotion can result in less gastrointestinal and respiratory illnesses, as well as reduced school absenteeism. So the COVID pandemic really brought to the surface just how important proper hygiene activities are. And in the height of the pandemic, there were a lot of questions that people had, including how to best keep hands clean, how to clean or disinfect, what should be clean and with what frequency, which products to use, and how to use them in a safe and proper way. So our team here at CDC at the time identified a need to increase the knowledge, attitudes, and skills related to hygiene, specifically for staff in educational settings. There was a need to develop a virtual training that would focus solely on the promotion of hygiene-related behaviors, and we wanted to develop a training that explained the importance of these behaviors and presented them in a way that spoke to the audiences in educational environments particularly. So to address these gaps, our team scoped out a new project that sought to develop an interactive lesson plan in an e-learning format. And to do so, we partnered with the CDC Foundation and with ICF Next to develop an instructional design and a curriculum. And we had a very strong team of talented web developers, behavioral scientists, health educators, and communicators, and multimedia specialists that helped craft the concepts and storyboards for building up the training. We also had the opportunity to pilot test and revise the training prior to launching it. And we seek approvals to accredit the training through continuing education units, CEUs. And finally, we launched the training, and we've been in the process of promoting it. So we created this training primarily for teachers, educators, principals, and administrators. And we also wanted the training to serve school nurses, custodians, public health groups, and national professional organizations. To inform the design and the development of the content, the team conducted qualitative data collection through 3 focus groups and 3 interviews with the target audiences. And these groups included 19 participants who represented early childcare staff, preschool teachers, elementary, middle, and high school teachers, special ed teachers, as well as head custodians. And the data gathered from these discussions led us to better understand hygiene behaviors in schools and ECE settings, review the perceptions of the proposed content, identify recommendations for how to best tailor and modify our content. And it also gave us an opportunity to learn of the unique needs that staff may face in these settings, which we'll discuss in the next slide. So based on the results of the qualitative feedback, we refined and revised the training and materials that we had in development. These discussions essentially confirmed to us that there was a big need to encourage adoption of hygiene behaviors in educational settings and the need for this training. It also helped us identify and understand the barriers that teachers and administrators are facing when it comes to hygiene in schools. And these issues may include things such as lack of time, a lack of training, the need for supplies or resources, perceptions that hygiene activities are not as important. So to address these challenges, we were very intentional about making adjustments to our content and to reflect some of these concerns that the focus group participants brought to us. All right, so let's now take a deeper dive into the components and themes in this training. So once you start the training, it provides the option of selecting your educational role and provides you a learning pad depending on your position or role. The imagery and the look and feel of the web-based module design was informed by the focus groups so that it best resonated with the intended learners as much as possible. So for example, there are 2 lead narrators who represent a school nurse and a custodian, and the aspects that you see in their appearance, for example, from what they're wearing to their facial expressions, were tailored based on feedback from the focus groups. And we're also very intentional about presenting diverse people and present them in a way that set a trustworthy tone in the content that they were narrating. So these are some of the course objectives, and we'll go over each of the 4 modules in the training. This is the first module. We cover why clean hands and spaces are important. And in this topic, people can learn how germs spread from hands between people and spread onto surfaces. It lists reasons to have good hygiene and clean environments, and it explains how the lack of hygiene can make people sick. The second module covers a series of 4 main topics. So, for example, it provides explanations for when to wash your hands versus when to use hand sanitizer, which key times are the best for each of those. It covers how to select the right materials to clean hands when creating a hand hygiene plan. It also presents strategies for instructing different groups of students about hand hygiene. And for example, this is something that we heard about in the focus groups. So people wanted to have like specific advice for teaching children with special needs, for example, or children, differences in how to teach children in kindergarten versus those in elementary, middle, and high school. And the last topic covers extra steps that can be taken in early care education settings to assist young children in particular. And it explains how to build hygiene into their daily routines. And it has a little bit more tailored content for practicing good hygiene, in particular, as it relates also to changing diapers. There's a section that talks about hygiene in diapers. And module 3 is all about cleaning and disinfection. So it discusses when and where and how to clean different surfaces, provides information to help identify what to include in an educational facility's cleaning plan, and provides tips for ensuring that the plans are followed. It also talks about safety precautions for cleaning, sanitizing, and disinfecting. So, for example, what chemicals, products, not to mix, or the safest methods for cleaning body fluids, for example. And it specifies practices that are more tailored for early care and education settings. And lastly, the fourth module is mostly about how teachers, administrators, and other staff can work with parents and caregivers to share hygiene information and messages to help children keep children healthy at home as well. So this section mostly provides tips for when to send information to caregivers and suggests the different types of communication dissemination kind of plans to use. So throughout the modules, you will see different interactive features. This is just an example of one of them. We wanted to build into it things like knowledge checks and quizzes that would allow people to pause, interact, and absorb and reflect on the content. This is also something that our focus group participants advise, so that people just have a space to better grasp and internalize the knowledge. This is another example, and this training includes highly interactive information. So, for example, you can click on the different kind of areas within the picture, and the idea is to keep learners engaged as they're interacting with it. This is another example. So we were also very intentional about providing a version in Spanish of the training. So it basically mirrors the English content exactly the same, but translated. This is something that we were just very intentional also about making sure that we had content that was available for Hispanic, Latino staff as well. So this is available. And the training can be found via CDC Train. So CDC Train is a national learning network that provides quality training opportunities for public health professionals. To access it, you can visit train.org, and you can search the course catalog by typing in Clean Hands and Spaces web-based training, and it'll show up in the pop-up. And you can also search for the Spanish version the same way. And people can take the training modules, at their own pace or at a time that's convenient to them. The completion of the training modules may take 2 or 3 hours depending on educational roles. So after completing all of the 4 modules, school and early care education professionals and staff can receive free continuing education credits. So this offering of these credits was an important factor for us to be able to reach and incentivize educators across the country, as we know that they're required to have a number of hours annually. So now I want to take the time to tell you how we promoted the training so far. So our team made available a package of creative assets and a promotional toolkit to support promotion of the new training. This promotional package has digital resources that include things like sample social media posts, blog article language, web banners, graphics, blurbs for things like flyers or e-newsletters. And we developed these assets in both English and Spanish, and we also made sure that the look and feel of the promotional content matched, the branding, and was very similar to the online training. And we also engaged with partner activities through. We launched the training in December of last year, and we've been through the spring of this year, and the rest of this year we've been just promoting it. So we established partnerships with national, state, and regional, local organizations to ensure broad awareness and promotion. So these are just some examples of our collaborators, which obviously include ACI, the National Education Association, the National Partner Teacher Association, NEHA, 0-3. And we also had engagement with partners who serve Hispanic Latino audiences such as Salud America and Mana, and so that they could help us also amplify efforts for the Spanish community. So these are examples of the different assets and materials that partners have developed to promote the training. And these are some social media, newsletter kind of examples. And for CDC, we've been promoting it through our, we have several different channels. So for example, the CDC handles during the month of August, be on the lookout for these types of promotions because we are gonna be doing a big push for back to school season. We also recently disseminated a newsletter through CDC's Waterborne Germs and Illnesses newsletter. So if you're interested in subscribing and receiving this, for example, visit CDC News and Updates and search for our water topics to sign up. And we also have a website. It's cdc.gov/hygiene. So we have a page that talks specifically about the training so that people can get to the links pretty quickly. So we secured 22 national organizations who supported our promotional arrangements. And 8 of these organizations had a state or regional focus. We were able to cover 19 states and territories. We also achieved 55 social media posts across Twitter, Facebook, LinkedIn, and Instagram. So we were able to reach more than 395,000 people. We also secured placement in 22 issues of e-newsletters across 11 organizations. We had a half-page ad included in the NIA Today magazine in the print edition of April. And since December, which is the time around when we launched it, 610 people have completed the training so far. And the CDC Train has this cool feature where people can actually review trainings, and our training already has 4.5 stars, which it's just very exciting for us to see that people are actually liking it and engaging with it. So now I am going to talk to you all about the CDC promotional materials that we have available for use. So if you visit, for example, cdc.gov/hand washing, we have a series of materials that can help support hygiene planning for back to school efforts and just for general, hygiene awareness in schools. So we invite you to download and print things that we have, such as posters, fact sheets, and stickers. A lot of these materials are also available for free ordering via CDC Info on Demand. And for example, you can use, posters to put them up on highly visible areas throughout the school. So for example, put them up on your classrooms on top of the sinks and the mirrors, or in cafeterias in the kitchen area. We also have a few fact sheets that parents, guardians, and caregivers can use, because those are directed more towards them. And we typically encourage, staff in school to give these fact sheets, to caregivers or to parents so that they can reinforce hand hygiene practices at home as well. We also have stickers and mirror clings that we've developed, and these can be used, in windows or, bathroom mirrors. You can make buttons for staff to wear if you want to do like a mini hand washing or hand hygiene campaign in the school. So there's like a variety of just promotional things that you can do in schools to kind of put the word out there. We also have videos that can be played, on TV screens, or can be disseminated digitally to staff. Or they could also incorporate the videos into things like lesson plans. This video in particular, we have it available in English, French, and Spanish. So, and it also has there's a version with audio and no audio. So depending on your needs in the school, you'd be able to use this as a resource, for example. And recently, we launched a new website called cdc.gov/hygiene. We're in the process of building up more health promotional content. We're going to be having, more fact sheets and posters. We're hoping to have some of those available this fall. So this is just a quick glance at our plans. But if you visit cdc.gov/hygiene, you can get an idea of the content that we have in there. So these are just a few resources and links that might be of interest. Direct links to the training in English and Spanish. And my email address is aandujar, ANDUJAR1 @cdc.gov. If anyone is interested in collaborating with us or increasing promotion of the training, we're happy to share the materials that we've developed. So feel free to reach out. And I also want to take a moment to thank, our team here at CDC, at the CDC Foundation, and at ICF, who collaborated and worked with us on this project. It was a year-long process, and it couldn't have been done without them, essentially. So thank you for your time and attention today, and this concludes my presentation.
Ashley, thank you so much for sharing all of that great information about the Clean Hands and Spaces training. As a reminder, this webinar will be made available for on-demand viewing and will be emailed to all registrants. We invite you to share it broadly with your colleagues. We also encourage you to please visit the Healthy Schools, Healthy People website for year-round resources on keeping our school communities clean, healthy, and safe. Please visit at healthyschoolshealthypeople.org. And as a final reminder, the American Cleaning Institute provides science-based information on cleaning, hygiene, fabric care, and disinfecting practices for multiple audiences, which you can find anytime on our website at cleaninginstitute.org. I'm Brian Sansoni. On behalf of ACI and our member companies, thank you for viewing today's webinar, and stay safe and stay healthy.